An overview of statistics, features, and treatment of schizophrenia, presented by Jennifer K. Upton. Schizophrenia is a complex mental disorder that affects millions worldwide. Schizophrenia is a serious mental health condition that affects millions of people around the world. According to the World Health Organization, about 20 million individuals live with schizophrenia globally, which means roughly 1 out of every 100 people will experience this disorder in their lifetime. WHO 2019. Most cases begin in late adolescence or early adulthood, and the effects can last a lifetime, making daily life challenging for those affected. A brief history and common signs. Schizophrenia was first introduced by Eugene Bleuler in the early 1900s. He used it to describe a group of disorders marked by disruptions in thinking, emotions, and social interactions. People with schizophrenia often show a mix of symptoms. Some may hear voices or hold unusual beliefs, while others might struggle with motivation, express little emotion, or have trouble remembering things. How schizophrenia is diagnosed. DSM-5 criteria. Mental health professionals use the DSM-5 to diagnose schizophrenia. According to these guidelines, someone must have at least 2 of the following symptoms for a significant part of a month, and some signs must continue for 6 months. Delusions, hallucinations, disorganized speech, severely disorganized or catatonic behavior, negative symptoms such as reduced emotional expression. At least one of the symptoms must be delusions, hallucinations, or disorganized speech. American Psychiatric Association, 2013. Types of delusions and hallucinations. Delusions are strong beliefs that aren't based in reality. For example, some people may believe they're being watched or followed. Paranoid delusion. Think they have special powers. Grandiose delusions. Or worry about their health without reason. Somatic delusions. Hallucinations involve sensing things that aren't actually there, most commonly hearing voices. Some people also see, feel, or smell things that others don't, but these types are less common. What happens in the brain? Scientists have found that schizophrenia involves changes in both brain structure and chemistry. Brain scans often show larger fluid-filled spaces and less gray matter in areas responsible for thinking and memory. Van den Heuvel and Fornito, 2014. Chemical messengers like dopamine are also out of balance, which helps explain why some symptoms occur. Treatment options. Treating schizophrenia usually involves a combination of medication and therapy. Antipsychotic drugs help manage symptoms like hallucinations and delusions by affecting dopamine levels. Miyamoto et al. 2012. Therapy, such as cognitive behavioral approaches, teaches coping skills and helps people deal with everyday challenges. Support from family, friends, and community programs plays a big role in recovery too. Living with schizophrenia, patient and family experience. Life with schizophrenia can be tough, not just for the person diagnosed, but also for their loved ones. Many face stigma and misunderstanding, which can make it harder to find work or maintain relationships. Families often feel stress and worry, but learning about the disorder and connecting with support groups can make a difference. References: American Psychiatric Association 2013. Miyamoto, Duncan G.E., Marks C.E., and Lieberman J.A. 2005. Treatments for Schizophrenia, a critical review of pharmacology and mechanisms of action and antipsychotic drugs. Van den Heuvel, M.P., and Fornita A. 2014. Brain Networks and Schizophrenia Neuropsychology Review. World Health Organization 2025. Schizophrenia. Thank you. Presented by Jennifer K. Upton.